Time we're told that the COVID-19 infection curve has plateaued, and that's according to the Health Minister, Phaahla, who was giving an update. He says the country is in a stalemate where there is no significant increase or decline. But officials are keeping an eye out for the fifth wave, which is expected to arrive with winter. Phaahla is calling on people to get their booster shots, and he's concerned about low vaccination rates among the 12 to 17-year-olds. Let's get more on this and what came out of the briefing by the Minister, eNCA senior reporter Aviwe Mtila. So Aviwe, plateaued, that is the word that the Minister of Health is using. What exactly does that mean?
Yes, instead of flattening the curve, Tulas, it's now plateaued. It talks to just the confusing number of infections that we've seen in the last 7 to 14 days, where the minister mentions that the numbers haven't dropped drastically, but yet they haven't risen to a point where it's become worrisome. We do understand, of course, over the last 2 weeks we have seen the schools opening, and this has been attributed just to that and the number of schools that have opened and the children going back to schools. So a lot of movement has happened, so which hasn't caused the numbers to drop drastically, but yet the numbers aren't worrying at this stage. We do understand, though, things should settle down by the end of February, where we can expect the numbers to actually drop quite drastically. Something that the minister, in fact, mentioned in that briefing that we saw at about 8 o'clock, where he talked about the numbers that have plateaued. Let's just take a listen to that.
Last 14 days, even the last 7 days, have started to give a more confusing picture. We have seen a less resilient decline in the infections. The picture we have seen has been almost that we can call a stalemate, where there is no serious decline, and yet we can't say there's any worrying rise in infection. Instead of the curve flattening, as we always say that we're striving to flatten the curve, this time the curve has been just on a plateau, no rise, no decline.
So it makes sense what the minister is saying there, Aviwe, because you and I are used to a sharp spike when a wave comes and a sharp drop at the tail end of that, such that you end up with a positivity rate. At some point it was below 2% or something like that. But this one seems to be, you know, hovering from around 8% to 10%, and it keeps going up and down. So I think that makes sense. But having said that, we've plateaued in terms of the fourth wave. There's now concern about the possibility of a fifth wave.
Certainly, and the fifth wave expected as winter comes in. In fact, there are indications that it might even be brought forward if we do see a new variant, for example, as we saw with the Omicron variant. But the minister quite stagnant that we should just vaccinate and also just adhere to those COVID-19 protocols in order to even avoid in terms of these fifth wave coming in forward. Something that he also touched on in that briefing. I just want to take a quick listen to that.
It is expected that by the end of February, we should be able to reach 5% of positivity, as I've indicated that once the schools now are settled, movement is settled, movement of people, we expect the continuing of the downward trend. But there is also expectation that as we get closer to winter, we'll get closer to the fifth wave. That the fifth wave is likely to break as we get closer to winter. Of course, it may even come closer earlier, depending on whether we experience variants of concern much earlier than we did with the Omicron. So only high coverage of vaccination will reduce also the emergence of more variants, and also will provide protection so that more and more economic and social activities can open.
But at the same time, Aviwe, while people are being encouraged to voluntarily go and get vaccinated, there are multiple debates happening around the issues of vaccinations. There's the issue of mandatory vaccinations in various spaces in our society, but also it seems the issue around vaccinating children over the age of 12 has not really gone away, has it?
Not at all. In fact, it's one of those issues that now has had the minister appoint an appeal committee that looks to that issue, specifically of vaccinating children between the ages of 12 and 17-year-old. In fact, in this briefing, the minister did highlight just the numbers of the school children that were now being infected in numbers. Hence now, of course, this ongoing debate and now being formalized with this appeal committee. We do understand it's going to look at that very issue and look at the possibilities, because there is two people that are opposing this. Of course, it is the organization called Free the Children, Save the Nation that are opposing these vaccinations, while on the other hand, there is the South African Health Products Regulatory Authority. So now the minister has brought in people to basically go in between and adjudicate this and see what's the best way forward, because in this recent update, we heard that a lot of the infections are coming from these young children as these schools have opened. Another issue that he touched on in this briefing.
Our epidemiologists believe that this plateau and a slowing down in the rate of new infections can be linked to opening of schools, and they will speak to that. In support of this is also the observation that in the last 14 days, we have actually witnessed more infections amongst the below 20 years of age. That is the school-going age. Some colleagues who are also in the GP practices have also reported similar observation of seeing more of school-going age below 19 years testing positive in bigger numbers.